Mental health as a burden in the community is worsened by the culture of not talking about it, not discussing it openly. One could bear this in mind, that every other patient that goes to other hospitals to seek care, whether it be endocrinologist for conditions like diabetes that have to do with hormones, or the cardiologist, bear in mind the need for people that have cardiac issues, and every other form of medical care. The patient come out and talk openly about the problem, where they sought help, when they got better, where they got better. But in mental health, mom seems to be the word. Few people want to talk about how they are seeking help, what the experience they are having, and then there is a tendency to want to deny that it's a mental health problem.
People don't want to be seen entering a psychiatric facility in the first instance. Nobody wants anybody to know that I have a relative that I'm coming to see a psychiatrist for. They are more comfortable to see other subspecialty, but not psychiatry, okay? Because of stigmatization.
Well, in the past, mental illness was actually a thing that people attributed to a lot of mystic powers, witchcraft and all that. And that was partly because of the lack of knowledge of mental illness or mental health in Nigeria.
But in this part of the world, there's a view as to how people perceive the theology of mental health. Majority of us, based on our culture, think that mental health is like a punishment from the God. Most times because you've offended the God, pay back with a form of mental health challenge or the other.
A lot of people like asking what causes mental illness and what makes a person mad, in quotes. Is it the gods? Is it smoking? The truth is that there are many causes. And unfortunately, when people develop mental illness, they immediately become victims of stigma. Stigma being an attitude, a negative attitude towards these people.
More and more as people get to know that mental illness comes in different forms. It's not just the man or the woman who is walking nude on the streets, but also in things as little as having sleep problems, eating disorder, or having a child who is not growing as he should. These things, as they come to the view, mental health is, and the need for a good mental health system is being exposed in our society.
As we engage and pursue all our efforts in life, stress inevitably comes. There are very few good things that don't come with stress, from going to school, from rearing a child, from engaging in a job. It almost seems as if stressful experiences are required for you to achieve.
You see, mental health tends to control every other part of your body, controls all other systems in the body. So if your mind and your mental capability is sound, then every other part of your body automatically, you can use it well, is sound.
That should be about 7 years ago or more. Unlucky me, that was my first day at work, and I was to see a patient that was quite aggressive.
I remember that we actually saw the same patient our first day at work.
About 4 times my size, big frame, and quite energetic.
It was really funny, and then we were really inexperienced, as he said, and ill-equipped with the basic skills to really handle violent and psychotic patients.
I was still the patient with a senior colleague, and within 15 minutes of assessment, the guy got very aggressive. And at that time, I don't have the skill to deal with aggressive patients.
Actually, I noticed that this patient was becoming very suspicious, and I suspected that this patient could attack us at any time. So I stylishly stood up from where I was. I took an excuse that I wanted to use the loo. The very moment I stepped out of the consulting room, I just had some noise, You know, there was confusion everywhere. He actually attacked one of our staffs.
There was an assault on myself and my colleague because we're new.
My most memorable patient, I met him this year, 2018. 28-year-old university graduate who was on admission. And what was his complaint? I am not from here. I am from another planet. My spaceship crash landed and I'm now lost. I cannot find my way back home. I don't know where the spaceship is. The G-Force police will be looking for me because I'm a member of the G-Force police. Why are you keeping me on the ward? I'm supposed to be out there looking for my spaceship and finding my way back to my home planet. Whenever we see something as interesting as this, we try to bring them back to Earth with some simple questions like, well, if you're not from here, does that make you an alien? If you're not from here, who are your parents? Why are these people your parents if you're not from here? The patient will try to rationalize by saying something like, oh, he actually said, when I crashed landed, I was a child. And these people adopted me. That was how he rationalized that. And of course, I then asked him, would G-Force have given a child permission to fly a spaceship? Questions like that may sound weird, but you use them to draw the person out of that delusion. So, because he was a graduate, I took it upon myself to go a bit more complex with him. I said that, let me tell you what is happening to you. You accept you are a university graduate from so-so-so school. You also believe that you are a member of the International Space Police Force called G-Force and you have crashed on Earth. What is going on with you is that your mind has divided into two. That's what I told him. And I told him it's called a split mind. One mind says you are so-so person in Nigeria, a Nigerian, these are your parents, this is your school, you are currently in a psychiatric hospital, Yaba. Your other mind is saying you are a member of G-Force, your spaceship crashed, you don't know where it is, you are stranded on Earth, your people are looking for you. And I told him that the word schizophrenia means a split mind, that's what has happened to him. He had some issues in his childhood and adolescence that were quite traumatic for him mentally that could have explained why his mental state broke down so much. I took time to explain to him on 3 different occasions. He actually took time to listen and it was fantastic. He accepted it. It made sense to him. He was like, doctor, it is true. Because he too had been trying to marry the two minds together. Now, the thing about mental illness, about patients like this, they are not joking. It is reality to them. If he hadn't been on medication, it might not have been that easy for him to be cognitively aware enough to listen to me and try to understand it in his mind. Because in schizophrenia, the mind has been split. Thoughts, language, thinking, memory, behavior, personality, everything is haywire, everything is scattered. Despite being a graduate, without that medication, he won't have been able to think about it, what we call capacity to understand. He won't have been able to understand, he won't have been able to listen, he won't have been able to cope. The drugs had done the groundwork. I just had to step in to help him realize and develop insight into his problem.
My training started in 2012, and my first patient was a lady who was accompanied by her priest. I do believe that the clergy has a place to play in mental health care provision. The priest, after counseling the lady about the problem for a prolonged period of time, realized that the problem was too distressful, and he decided to bring her to us for professional help. The lady had been complaining about thoughts that she recognized to be her own, and it was intruding on her consciousness, and she found it to be distressful. She wasn't able to control how and when she had this thought. The content of the thought itself was truly terrifying. The lady was repeatedly experiencing thoughts that were asking her, to stab her mother. She recognized that it was not a voice, but it was just a thought that was intruded into her consciousness. And this, as a first patient for me, on my first day at work, on my first day of the training, made me realize I needed to dwell more on the books, to read and acquaint myself with the case at hand. I was being supervised by the senior registrars and the registrars in my team. So after I'd reviewed the lady, after I'd assessed the lady, I reviewed my findings with them, and they guided me to appreciate that the lady was having obsessive thoughts, in that part of a condition that was regarded as an obsessive compulsive disorder. The lady was aware of how inappropriate the thoughts were, so we could say she was insightful. These are tenets in mental health that I got acquainted with firsthand as part of the training. And it was a fulfilling experience to help the lady put a name to her condition and receive treatment and experience the resolution of her problem over a period of time as her treatment continued. That was my first case of psychiatric care.
In our practice, we see they come in different forms. Generally, no two patients are the same. There may be some subtle similarities, but their backgrounds and where they are coming from is different most times. For me, the one that really struck me was when I unknowingly exposed myself to some sort of danger. I was seeing this woman. She was a middle-aged woman, came in with her son. She had been ill for a long time, and based on their low financial status, she wasn't able to access help till they brought her. And while doing my job studiously, taking down my notes, there was a remote control on the table, and I could have given her some medications to make her sleep, but I didn't, because I wanted to get the psychopathologist firsthand. And she grabbed onto the remote control and threw it at me. Luckily enough, my reflex was quite sharp, and I was able to block it off, and I didn't get injured during the process. But what now struck me again was during the conversation, I was a bit angry, but I had to comport myself. The son was very irritated with the way his mother was behaving. And during the course of consultation, he slapped his mother. For me, I couldn't bear that. And I went berserk with the boy. And I was very sad. I was screaming at him, why in God's name will you lift your hand to slap your own mother? It was a very sad situation. And the boy, I felt he was frustrated, and he started crying. And his mother was just still misbehaving. But two of us who were okay, and I felt bad about the whole thing, and he felt bad and was really weeping. I told him to apologize. He tried to do that, he prostrated. It was a very sad one, and you could see the effect of mental illness on the whole family.
Majority of the populace also don't understand how drugs can treat mental health. In view of this, when we talk about pathway to care, majority of patients we see, okay, we don't tend to even see them early. They would have been taken to one religious home or a traditionalist, okay, for treatment. And over time, that would have spanned a long number of years before somehow they get to bring them to the hospital. And there's a relationship between the outcome of treatment and duration of illness before you come for such treatments.
It's not enough to just wait for the person to develop to go crazy, or to smoke weed, or to attempt suicide. You don't have to wait for that. There can be policies, we call it universal coverage, universal prevention. You can start at an early age with health promotion, health prevention strategies right from primary school, right from secondary school. Identifying vulnerable people, vulnerable children, vulnerable adolescents, vulnerable university students who are at the edge of developing mental illness.
Because inevitably, anybody that's saying that it doesn't run in my family, it doesn't happen to me, have not experienced the level of stress that they can handle. Because life is full of such occurrences. People don't plan to be sexually abused, but when it occurs, they will need the help of a mental health specialist to help them address it. People don't plan to be bereaved, and there are certain scenarios that can be significantly heartbreaking that they will need the guidance of a mental health specialist to help them navigate through that period. Someone, the individual who lost his family when the truck fell from the bridge and crushed them, you will realize that that is a significant stressor.
In my view, I think it's gradually improving. Of course, bearing in mind that we are developing countries, no doubt about that we are a developing country, but it is getting better gradually. In the past, psychiatry used to be a minority subspecialty, but that is not the case now. We have a lot of psychiatrists now in Nigeria, for example, although we are not saying we are enough. But you can't compare the number we have now with what we used to have in the past.
The doctors who are being trained in Nigeria have been poached away. So the young, upcoming generation have been poached away by better remunerations, better wages, good source of living, steady life whereby the future of your children, yours and your children is pretty much secure, by countries who appreciate and understand why you need a very robust mental health practice in your country.
At a point, we were having more and more psychiatrists graduating from training centers around the country, but with the brain drain and the sudden disinterest in psychiatry, that number is reducing. If the governments, both federal and states, can actually properly legislate that psychiatry should be embedded right into the communities and will be paid on time, I believe that we'll be able to start this universal prevention of mental illness. We'll be able to catch the children young. We'll be able to stop or prevent children from breaking down with substances of abuse and other problems.
To reduce brain drain that is presently going on in the private or mental health, on the health sector, I see a future where doctors will come back from abroad and start working in Nigeria. I see a future where there will be more specialist centers and general hospitals where you are specialists that are trained in the act of taking care of people with mental health challenges.
And I think Nigeria should not lag behind. The human resources is there. There is the commitment by those who should put things in place to keep these people here, whereby they can give their best to their country.
The country is ours and it's for us to build it.